Here's a headache that you don't want to miss if you're dealing with something like connective tissue disorders or dysautonomia. Intracranial hypotension is a condition that causes low pressure in the brain that is usually the result of a cerebral spinal fluid leak somewhere in the spinal cord. So when there's a leakage of the cerebral spinal fluid, there's less pressure inside of the skull, and because there's less pressure inside of the skull, the brain starts to get pushed down into the skull, which can create a severe headache that often feels like a migraine. These cerebral spinal fluid leaks are known to cause headaches in patients that get a procedure like a lumbar puncture, which is often used to diagnose different conditions like multiple sclerosis or meningitis or things of that nature. And whenever there's an injury into the spinal cord, if that injury doesn't heal well, that leakage can start to occur, which is a known problem that will cause these types of headaches. And when people know that these headaches are a result of the puncture, then people can treat it relatively quickly and most of the time pretty successfully. However, there are patients that can develop this condition even if they haven't had any type of spinal surgery or lumbar puncture or epidural, and it happens spontaneously. And in that situation, it's often classified as spontaneous intracranial hypotension. The condition is often missed and misdiagnosed for years because it shares many of the same clinical features as a migraine headache. When people get imaging, their imaging may oftentimes look normal unless there's a radiologist that is specially trained to look for these types of things and some of the specialized findings that can show up with these types of MRIs. But up to 20% of MRIs in intracranial hypotension actually looks normal, so it's going to be missed for that as well. We talked about not wanting to miss this type of headache in patients with dysautonomia or connective tissue disorders. That's because many patients with POTS often have migraine headache as one of their chief symptoms, and many patients with Ehler Danlos also have POTS. So this leads many patients with POTS and dysautonomia leading to a migraine headache diagnosis because it's the most common manifestation of POTS. However, there are studies that are showing that there's a high probability that patients with connective tissue disorders like Ehler Danlos Syndrome have a higher rate of cerebrospinal fluid leaks. The classic sign for a CSF leak headache is that the headache intensity is quite severe, and then almost immediately within lying down, the headache intensity will start to die down. The other aspect that can be implicated is whenever you do a Valsalva, which means you take a breath in, hold it, and bear down like you're going to the bathroom. That can also be an exacerbating factor for these types of headaches. So the clinical features that I'll look for in the patient when I'm assessing this type of case, I'll look at their clinical history, meaning do they have something like Ehler Danlos Syndrome? Do they have a connective tissue disorder like Marfan syndrome? Have they had a recent or previous history of a spinal tap, a spinal surgery? Any type of traumatic head injury or whiplash can also damage some of those aspects of the spinal cord, leading to these CSF leaks. Also, if they've had a lot of different migraine treatments, and despite having these migraine treatments, their headaches are pretty much daily and they're not being really affected by these medications. Plus they have this orthostatic headache pattern, and that is all telling me clinically that this person has a high likelihood of a CSF headache, especially whenever other treatments have not really worked for them. We refer the number of these patients with these clinical signs to their medical providers to get evaluated for CSF leak, and some of these patients will then get a blood patch or epidural glue type of a therapy that hopefully will seal the leak. And if the leak seals, some of these patients can get almost immediate improvement in their headaches that hopefully is durable as long as there's no other leaks that end up occurring. And that could change someone's life when they're getting the right treatment for the right type of headache.